My name is Rohit Mehta. I'm a cardiac electrophysiologist in Charlotte, North Carolina, and a member of Heart Rhythm Society. And we're here as sort of a breaking news discussion on Heart Rhythm TV. I have the privilege of having in attendance today, and joining me is Omar Carter, who's actually a patient of mine, a sudden cardiac arrest survivor, a good friend, and the founder of the Omar Carter Foundation, which is focused on raising awareness around sudden cardiac arrest. And as everybody knows, there was a major story today in that the son of Bronny James suffered a sudden cardiac arrest on court and was resuscitated. Omar, I'll turn it to you. You know, this is obviously a very personal thing as somebody who survived this event. And has talked to a lot of people across the years. Talk to me a little bit about what emotions you went through today, hearing the story, what things it brought back, and kind of your thoughts behind this as a patient.
Yeah, absolutely. First, thank you for having me, Doc. Thank you to Heart Rhythm TV and all of those involved. You know, as soon as I heard about the story, it was somewhat triggering. Being 10 years removed from my actual incident, it seems like yesterday that it happened. I was actually on the court just like Bronny James playing in a pro-am basketball game in my local town of Charlotte, North Carolina. And long story short, my heart stopped for 13 minutes and I was resuscitated and brought back by an AED and bystanders at the gym. And so I think, you know, with a lot of care from yourself and individuals over these last 10 years, it's been a little hard to hear what he's going through. I can only imagine, you know, what the diagnosis may be, what his family's going through. But I think the important pieces are, number one, he was brought back fast. People jumped into place fairly quickly. And then hopefully he gets an understanding of what is happening around him. I know for me, that was one of the main things that I wanted to know, you know, what happened, kind of that confusion around what I had been what I had suffered with. And I think, you know, as things play out over the next couple of hours and the next couple of days, those are the things that, you know, he'll kind of come to grips with, and he'll learn exactly what's going on.
Great points, Omar. You know, one of the things that I know was particularly important during your resuscitation, can you talk a little bit about the availability of resuscitation equipment, people kind of in the stands available and able to do CPR? Can you talk a little bit about what the experiences that people told you went through at that time?
Yeah, absolutely. So when I actually went down, there's a video ESPN E60 actually did, was gracious enough to do a story. And so you can see during that video where when I went down, my teammate actually came over, knew something was wrong, and bystanders, including a ICU cardiac nurse from Atrium Health, just so happened to be at the game, and she started doing compressions fairly quickly. And I think that was one of the most important pieces is recognizing what happened or what was happening, kind of where I thought I'd go in and start doing compressions. But also an AED was also on site too. So her knowing exactly what to do, her as in the bystander, the ICU cardiac nurse, she told bystanders to get an AED machine. They started doing compressions. I was shocked 3 times. And then also just calling ahead to the hospital to let them know what had happened. I think those in large part were one of the many reasons I was here, but then also the great work at the hospital and Atrium and Sanger. I am here speaking with you today.
Yeah, thanks for sharing that with us, Omar. You know, I think one of the things that strikes me is, as we've heard the stories of now Damar Hamlin and Bronny James, that the speed of resuscitation has gotten much quicker. You know, a large part of what's happening in that field actually has come from a lot of the work that you've done in awareness. So can you talk a little bit about the foundation and kind of what you're doing with regards to CPR and AED awareness, and how that might have played a role in kind of the speed and efficiency of what we're seeing on the field today?
Yeah, absolutely. And I think just taking it back to that night, it was probably, you know, 100, 200 people in the gym that evening when I had my cardiac arrest. And arguably only a few bystanders knew what to do or, you know, wanted to kind of step in and start compressions. And so I knew there was a need there, obviously connecting with yourself and a lot of our board members to on the work that they had already been doing even before I knew kind of what had happened with me years prior. And so the foundation, we teach bystander CPR and AED awareness in the community, and that's teaching this life-saving skill, but then also how to use an AED machine, how to recognize it, and how to properly work it. The other piece of that is also placing AEDs within gymnasiums. Sounds like, the story's still developing, but it sounds like Bronny had all of those things as far as fast acting individuals, but then also the equipment that was needed. And so those are the things that we kind of want to put out there to the community, individuals, and loved ones to have the information, know what to do, and to be fast acting. And that's kind of, I think, one of the reasons Bronny is here today is because of individuals like the ones that we're reaching are able to have this fast acting skill.
Yeah, great points. And, Omar, you've been very, very generous with sharing your story and also your medical information with the public. One of the things that I think we often think about is, shouldn't we be screening for this? Shouldn't this be able to prevent these things from happening? But as we know in your case, you had an extensive amount of screening done when you were a kid. And overall, things looked good. And by all criteria, you were safe to play and still yet suffered the events. So, one of the things that I've been struck by in your journey and the things that you're doing within the community that you shared with Heart Rhythm is the ability to teach people to get medical care, to take care of themselves on a regular, plain everyday basis, so that things like high blood pressure, coronary artery disease, heart attacks, the things that are kind of what I call the low-hanging fruit that we can find and treat, get treated, and that we're left with kind of these outlier examples that unfortunately are not findable at this time, right? Our hope is that in the future that does change. But this is to some extent a call to arms of our membership to be actively involved in the community. I think back to almost a year ago in San Diego when we were at FHRS and talking about this. And the hope is that our members took that fireside chat and took it back to the communities that they serve, and are spreading this on behalf of Heart Rhythm Society, on behalf of the Omar Carter Foundation, and our field in cardiac electrophysiology. Anything that you wanted to ask and talk to our viewers on Heart Rhythm TV about Bronny's specific case, or just in SCA in general?
Yeah, I first like to say, Doc, I think a lot of our success as an organization, my success as a patient, and from a mental standpoint, and we didn't have to have any really physical rehab, I think has been a large part from you and our team. And so, when you have somebody like yourself, I think that kind of goes into your point of just really get involved to the community of HRS, is just to really talk to your patients, get involved with what they may be going through, and really just a call to arms for getting involved in the community. I think myself and you, Doc, is the kind of a representation of success, what success looks like, outside of just the hospital. I think it's a true testament to patient care. And I think, my hat's off and kudos to you for that. And so to the rest of the community, I would say, I think this is just another reminder, like Damar Hamlin, Bronny James, and what he's going through, of how important it is. I know there's a lot of individuals that this may not happen to on a national level, that it's actually happening more often than not. It's just these two have more of a visibility, if you will. And so I would say, whether that's the Omar Carter Foundation, Heart Rhythm Society, just really start the conversation and do, exactly kind of what me, Doc, and our team is doing, and really get boots on the ground, putting our gloves on, and really, just training the community. Because I think even if you don't maybe have the time to volunteer and get boots on the ground, just have conversations with other, maybe donate, but get involved in some way.
Yeah, Omar, great points. One of the things I wanted to ask you about was, I know we've talked a lot about kind of the mental health components of this, and you've been extraordinarily generous with your time. I can attest to a number of my patients who've sought you out or have asked me to put you in contact with them, having suffered an arrest. But the conversations that you've had with other patients, can you talk a little bit about, what you've seen during those conversations, how it's helped you and maybe how it's helped them as well?
No, that's a great perspective, Doc. Didn't really think about it that way. I had a conversation with an individual, I think a few months back, that you put me in contact with. And that conversation, after, me celebrating 10 years this past, just a few weeks ago, kind of put it in perspective of, things that I maybe needed to continue to get through. And the fact that it's okay, these things take time. And, dealing with the anxiety of, just thinking like, am I by myself? This only happens to me, and that's just not the case. And I think I'm reminded of that each time I talk to a survivor. And so I go back to just where it started, right, with my family and even yourself as a physician. I think having the trust and the care there was the first thing for me to be able to begin to lead a normal life. I think after that, having our relationship, but then even going and talk to other survivors and other individuals just kind of gives you that confidence. And so I would say just to other survivors, continue to put one step forward. To the physicians, as I mentioned before, just if you can, I know you deal with a lot of patients. I think it speaks volumes just to show kind of that, we do care, what can we do? And I think even just getting in the community. And so it's been helpful. But again, it's something that anybody that's had a traumatic event has kind of went through. It takes time. And I think the word here is, or the two words is, it's okay.
Yeah, thanks for that advice, Omar. So, to kind of wrap things up, I know we've got a little bit of time sensitivity here, but if you could give us kind of three things that you would want so that events like this don't happen again, and then maybe following that up, is there a message that you would have for Bronny as he's going to go through a very personal, life-changing event, and for his family as well? If there was anything that you would give them as advice.
I think one is what we mentioned before, just recognizing kind of what the state of SCA is right now. I think recognizing that and really doing some research and figuring out, number two, how we can get involved. And so I think one, recognizing, number two, how we can get involved, what that would look like, for whether that's volunteering your time. Obviously, money may play a factor, but I think, within all of that, starting the conversation. And I think number three, I think this is just a testament to really, if I may speak, plainly and frank, is let's do something about it. I think a lot of what we're seeing now is conversations and really having an awareness for it, but I think it's time for us to really do something about it. And that may not be from a foundational standpoint of what we're doing. I think it's just everybody that has this work within the community. I think it's time. I think my advice would be not to tell them what to do or anybody what to do, just a matter of an example of what I went through. And how I coped with it is just, number one, recognizing that it did happen. This is something that happened, and it's okay to be afraid. It's okay to kind of sit back and internalize it. And then I think after that, it's just a matter of taking the steps that to help with your recovery, and know that it may or may not take some time, right? Everybody is different. For me, it took time. And then, so I would just say, we're here, obviously, if you need us, to please reach out to us. But I think recognizing that it's here, obviously he's on a different level when it comes to, his stardom. So I would say spend time with a lot of family and take your time. You owe nobody anything. And I think that's the most important thing.
Now, great point. And, Omar, from my standpoint, if I were to kind of give some take homes to our membership, number one, take care of people, right? So take care of your patients, take care of your community exceptionally well. Number two, I think all our physicians and our nurses and our immediate staff know CPR, but demand that of your hospital systems, your hospitals, your practices, people that aren't clinical. Make sure that everybody that you touch knows how to do CPR, whether that be your patients, and feed that forward.
Right.
And do that at the community level. Engage your community in terms of the regulatory pieces to make sure that there are regulations in place to ensure that there are AEDs within your community.
Right.
I would say outside of that, advocating for teaching in schools, helping to procure funding for those things to actually happen, and engaging organizations like yours to make sure that we're spreading this far and wide, because medicine won't accomplish everything in this. Screening won't accomplish everything in this. And so our chain of survival is really our community, and making sure that that's solidly in place, so that, like yourself, like Damar Hamlin, like Bronny James, we get better and better and better as time goes on, and really serve our patients and our community well.
I agree.
Well, Omar, thank you so much for your time. It's always great speaking with you. Unfortunately, having to do this under not so great circumstances, but I really appreciate your candid approach to this, your ability to share your own experience with everybody, and thank you again.
Yeah, no, I thank you, Doc, and I appreciate you. Obviously, we've had some time on camera and off, and I think it's important to continue to kind of spread the message of just that how you instrumental with my care, but then also just from a personal standpoint. And I think that's important. So I appreciate you thinking of me and sharing this time with you. This is our second time doing this, but like you said, under these circumstances, it can be kind of tough, but glad we were able to do it.
And I do think we have to give a little shout out to your wife, who's currently taking the bar.
Yes.
So best of luck to her as well.
No, thank you. Thank you. Appreciate that. I'll let her know.
All right.